Okay, so welcome everyone. I am here today with Adrian Ortega. She is a local acupuncturist. I'll tell you a little bit about her. She is a holistic licensed acupuncturist and herbalist, nationally certified Chinese herbalist and acupuncturist. She received a master's degree in acupuncture and oriental medicine from AOMA Graduate School of Integrative Medicine in Austin, Texas. She has 5 years of experience treating patients for a variety of illnesses, including women's health, IVF and IUI support, fertility support, immune support, stress and anxiety, airborne food allergies, and alleviating cancer treatment side effects. Adrianne specializes in women's health and fertility, allergies, and pediatric health. Her business is Alma Acupuncture, and she is in central El Paso with us down on Montana, and I'll put more information about that. It's actually on the event page. So this might seem for some people like an odd topic for Ask a Birth Professional, but that's why I wanted to have Adrian on here, because I really had no idea how many pregnancy and birth related issues can be treated with acupuncture. So let's just back it up a little bit and start with, what is acupuncture? Because I think most of us have heard of it, but not everyone necessarily knows what it is. So Adrian, just, what is it? Where is it from? How long have we been doing it?
Yeah, sure. So I learned traditional Chinese medicine. So the way I learned it is originally from China. It doesn't mean that other countries do not have it. I know Japan has their own system and Korea has their own system. But I learned traditional Chinese medicine. So it's basically a natural way of healing, to tap into your natural resources in order for the person to be able to heal themselves. I like to think of it as in that I'm trying to help people reconnect to their intrinsic ability to heal naturally.
Okay, and they've been doing this in China for, traditional Chinese medicine is old, right? Like how long, how far does acupuncture go back?
Several thousand years. They're estimating about 4,000 or 5,000 years. So it's been around quite a while. So it's not really this new medicine. It's just very new to our country, to the West.
Mm-hmm. And what are some of the main things that people would go to be treated for, I don't know, in China or in traditional Chinese medicine for acupuncture? What are the common things that they use it for?
In China?
Mm-hmm.
Okay, so definitely a different kind of way to not look at it, but the most common reason that people go and seek acupuncture in China is for, I believe, number one is stroke. Yeah, it's really effective, so really different. And then I believe the second one, or it's reversed, first or second, I can't remember. I always get them confused. Bell's palsy. So whenever people, are you familiar with Bell's palsy?
I've heard of it, but I couldn't tell you what it is. So
it's basically
sure.
one of your sides, either left or right, half of your face, you can't move it. So it's phenomenal for that. I've had actually several patients since I moved to El Paso, and I've been able to help them. It's kind of amazing because their face tends to droop and like they can't smile, their eyes tear. There's a lot of eye issues, duct issues, and they can smile again. It's kind of amazing. It's actually really amazing to see like before and afters of Bell's palsy with acupuncture. It's pretty phenomenal.
Wow, that's got to be probably one of the most visible examples of it working well. That's got to be really rewarding. Okay, so Bell's palsy, not super common, but you have treated it. That's awesome. Before we get into like all the pregnancy stuff, though, I want to just get a little bit more on you. So how did you become a practitioner? What brought you to acupuncture and Chinese medicine?
It was about my mid-20s when my immune system kind of crashed. My body kind of hit a wall. And I wasn't able to get a lot of answers from Western medicine. I had blood tests and I went to different doctors and different specialists and everything was normal. But obviously I didn't feel normal. I felt like my body wasn't cooperating and functioning at its most optimum. And if, I was 25 years old, there shouldn't have been there was nothing drastic that happened in my life that made me hit a wall. So I just wasn't able to get a lot of answers. I went to naturopaths, I went to chiropractors, and I didn't get a whole lot of answers. And then I had been an acupuncturist maybe a year before that. And I went to an acupuncturist again. This was in Austin. I used to live in Austin where I went to grad school. And someone told me, oh, you should go see so-and-so. I heard she's great. So I started seeing Jen, and she was fantastic. And I felt like I was able to start healing in a way that Western medicine wasn't able to offer me. So I started healing and started feeling better. At the same time, I also kind of was a little disenchanted with my career choice at the time. So it was kind of like the stars aligned. I was really sick. I was getting better. I was really frustrated with my current career. And I was like, I started researching and actually thought about going back to midwifery school here at MLL, and didn't work out. Obviously, everything worked out the way it was supposed to. I think I probably do better if I'm not on call. I think I do really well if I can sleep through the night, so I can stay healthy. But yeah, I'm really happy with the choice that I made. It's definitely changed my life for the better. So that's...
Yeah, I think a lot of us, that's how a lot of us happen on our career paths. It's something that changed our lives, something that we found, that worked and we believed in. I had no idea that you were considering midwifery. That makes
oh my gosh. I obsessed, kind of obsessed, where I would read books on midwifery, blogs. I've always been very, of course, pro-woman and being strong and being powerful. And it was just, and then in my mid-20s, I started feeling stronger and more powerful with this amazing medicine. So I was like, wow, I really needed to learn what this is all about. And from the very beginning, I knew I wanted to help women's health. And I knew that I needed to come back to El Paso to serve my community. And so here I am.
Well, that's awesome. We're very glad you're here. You're a fantastic resource, and that's a perfect segue. So you had this interest in, pregnancy and childbirth, and that is quite a lot of what you treat, is it not? Issues related to pregnancy?
Definitely. I had my lovely front desk ladies run some numbers for me, and so we got the percentages, and cool. Pretty much on a weekly basis, I treat 40 to 50% fertility / women's health, which is pretty high. 20% emotional, which means depression, anxiety, panic disorders. About 20% pain. About 10% NATE, which is allergies. It's this other system, which we might have to do a whole other thing on. So I'll try not to get too much into it. But yes, it's this other system that I treat allergies with, which I'm really passionate about also.
With acupuncture?
Yes, it includes acupuncture. Mm-hmm.
Okay.
Yeah. And okay. About 10, 15% pediatrics. Okay. Usually that number goes up a little bit more in the summer. So because kids are off and moms have more time, dads have more time.
Oh, okay. Okay, that makes sense.
Yeah.
Okay, well, let's talk about what are some of you mentioned fertility. So why don't we just start there before even getting pregnant? This is a real tough one for a lot of families. People spend thousands and thousands of dollars trying to have babies. So this one is really dear and I think super important. So why don't you tell us about how you do that and how it works?
Okay, so basically whenever I treat women for fertility, everyone has their own journey. Some women come to me and they've done 1 round of IVF, maybe a couple of rounds of IUI. Maybe they haven't done any IUI. IUI.
What's up?
IUI is intrauterine insemination.
Okay.
Okay. I'm sorry, this is my jargon that I talk about all the time.
That's why I'm here.
Okay, and then some women are not doing any kind of Western intervention, and they've just been trying for a long time, and they wanna, a lot of women are calling it having an organic baby now. So they want an organic baby, so they come and see me as an acupuncturist and herbalist, and I help them analyze and figure out what's going wrong. So I figure out a lot of that information naturally through basal body temperature. I analyze basal body temperature charts like all day, every day in my office, and I diagnose them according to traditional Chinese medicine during different phases of their cycle, the follicular phase, the ovulatory phase, and the luteal phase, and see what's not adding up. Are they anovulatory, which means that they're not ovulating? Are they ovulating too soon? Are they ovulating too late? There's a lot that goes into getting pregnant and conceiving. I mean, they call it a miracle for a reason. Absolutely. So some women, I help them analyzing that. So I do that for them, and we do acupuncture and we do herbs and maybe some lifestyle factors, maybe changing up. Maybe you should eat more iron at this time in your cycle versus another time in your cycle, things like that. And then with IVF and IUI, I usually encourage women to come in at least a month before they're gonna do their IVF cycle or an IUI cycle. I feel like my women that do that tend to do better. There's lots of side effects during that time. Your cycle is not your own whenever you're doing IVF, which can be a little tough on the body. Lots of progesterone's really high, estrogen's really high. So lots of side effects that acupuncture can help with, like constipation, headaches, migraines, irritability, weepiness. All of that stuff is really, really helpful. So one of the main reasons that acupuncture is so helpful, and they've done so many studies with fertility and acupuncture, is because whenever you're trying to conceive, I'm sure you know this, but you have to have a lot of progesterone, right? To get pregnant, to conceive, and to stay pregnant. And then if you're really stressed, your cortisol goes up, which is your stress hormone, which will inhibit progesterone. So that's a problem. You could have all the injections that you want and take oral progesterone, but if you're still having lots of cortisol, that stress hormone, it's gonna be a challenge to conceive. So that's where acupuncture comes in, and it's really, really helpful.
Okay, great. And so what is do you know your success rate with fertility? How many of the women that you treat end up getting pregnant after they see you?
So I don't keep those stats because it's really hard. I know this sounds really cheesy, but it's really hard to keep those stats. One, because there's some physicians in the city that do assisted reproductive technology, and they do not allow them to come for their post-treatment, which is after IVF. So the studies show that acupuncture will increase your chances of conception with IVF and IUI if you have a pre and a post 24 and 48 hours before and after. Does that make sense?
Yes.
So whenever women tell me I'm seeing so-and-so, I just say, well, I can't guarantee results. I can only guarantee maybe 10% increase because you're not able to come for your post-treatment. Does that make sense? Mm-hmm. Mm-hmm. Most patients can come to their post-treatment if they're not seeing certain physicians, but there are some physicians that say they have strict bed rest. So then that makes it hard. I'm not saying it's not helpful before, because I think it is, and then not coming at all.
Okay.
But it's tough. And then as for naturally, most of my patients honestly do get pregnant naturally. Our stats, since I changed my protocols and became a little bit more strict on my protocols and how often you have to come, Since January 2016, we're averaging 1.5 pregnancies per month.
Wow, that sounds like that's a pretty good number. So
Yeah.
these are then patients who are not doing IVF or any of that. They've had trouble conceiving and they're coming to you for acupuncture and then they get pregnant after.
I would say about 70% of my patients are coming for just natural. They need a break. They want to try something different. Basically, I feel like what happens at my office is, oh, Adrian, I came to see you because I don't know what else to do and I've done everything else.
And they often have success.
Yeah, it just depends, what is the patient willing to do? Mm-hmm. I think that's always helpful for me to know, to kind of gauge, what are they willing to do? Are they willing to give up soda? Are they willing, if they're a marathon runner, are they willing to cut back 50, 70%? There's a lot of factors that go into why they're not being able to conceive.
Right. It's not just a one-shot silver bullet. Okay, so let's talk about some more of the pregnancy and childbirth related issues that you treat. What are a couple of the big ones?
Okay. Big ones would be, a lot of my patients maybe go longer with their pregnancies and they just know that. Maybe they go past 40 weeks. So studies have shown that if patients start coming once a week to acupuncture at week 35 to 40-ish, depending on how long the baby goes, right? It actually decreases the duration of labor by 3 to 8 hours.
Wow.
Which is pretty significant. They don't call it labor for nothing. So I feel like most patients really do well with that. I had a patient that she was able to conceive with the help of acupuncture and herbs. And I saw her postpartum also. And she started coming at week 34 once a week. And her labor, I think, was 7 hours. First baby.
Wow.
She also had a doula, which was fantastic. I think that's definitely helpful.
Absolutely. Sounds like a winning combination.
Absolutely. And I always tell women, it'll be a bigger bang for your buck if you do the acupuncture. I mean, you want, especially if they're trying to reduce the chances of having interventions.
Right. Yeah, absolutely. Who doesn't want a faster, easier labor? Yeah. Okay. So ease of childbirth and labor. And then let's see. Can you talk a little bit about PCOS?
PCOS.
You treat PCOS? Or do I have that wrong?
I do.
And what exactly is that? Like, I know it's a women's health thing, but I don't totally understand it myself.
It is. So there's different kinds of PCOS. I don't want to get into it too much because we could definitely do like a whole 20-minute thing and I don't want to seem a little incompetent about it.
Okay.
It's basically, PCOS is basically, it makes your cycles very irregular. And a lot of women that have PCOS do not ovulate every month. Mm-hmm. So I'll have women that come in and they're like, oh, I haven't, it's February and I haven't had my period since October. And I'm trying to get pregnant. Well, that's a big problem.
Okay. So that ties in more with the fertility then. Mm-hmm. Okay. All right. And then what about, I know a big one that really stresses a lot of women out in pregnancy is breech. So that's when your baby is head up and feet down, and most I don't know if there's any physicians in El Paso that will deliver a baby that way. So for a lot of women, if they have a breech baby, that means they're getting a cesarean. I don't know too many midwives, even home birth midwives, that'll do it. There's one or two. So breech is a major obstacle for women who want a vaginal birth or a natural birth. So one of the people I know now that I can recommend when women have breech is Adrianne. So tell us about acupuncture and treating breech.
Yeah, so there's a famous point on the toe, on the baby, on like the little toe. the last toe. That's famous for helping turning breech. It's kind of amazing. I know it sounds really strange. I'm not even going to pretend like it sounds normal because it sounds very out of the ordinary. But yeah, I treated breech last week. I believe it was successful. And usually it only takes 1 to 3 treatments to help turn breech. And I believe my stats are 13 out of 15 are able to go head down, which is pretty good. It's super non-invasive, not terribly uncomfortable. It's pretty effective. So I would say if you know anyone that has a breech baby, you should send them my way, absolutely, because it is a really scary thing, especially if a woman, wants to either have a vaginal birth either at the hospital or at home. It can be really scary, and you just want everything to go well. And so that can cause a lot of anxiety, which isn't good for anybody, mom or baby. So yeah, it's pretty neat. It's pretty neat. The baby starts moving usually during the treatment, and that's usually, yeah, it's really cool. You can usually see them move, and yeah, it's pretty neat. It's always a good sign when they start moving during the treatment. I'm like, all right, I think baby's gonna move. So.
Wow, that is cool. So you do acupuncture on the little toe, and somehow that.
Yeah, and then, sorry to interrupt. And then we have, in Chinese medicine, we have this, it's called moxa or moxibustion, and it's like this big incense stick. It's about that big, and it's made out of mugwort. So it's basically just, I know, sounds like something out of Harry Potter, right? And so it's this big incense stick. I wish I had it with me. I'm sorry. But yeah, it's big incense stick, and you put it not directly on it, on the baby toe, but around there, and baby's turn. It's super famous.
Wow. Okay. Yeah, because when a woman has breech, it's like everybody usually kind of, not just the family, but even the doctors just, everybody's really nervous and anxious about that one. And yeah, it's generally that's a scheduled cesarean. So, wow, that's wonderful. Is there anything I've missed related to pregnant women that we should talk about?
Yes.
Okay. What?
So I think this is really big because a lot of my patients that I deal with fertility, a lot of them, a good handful of them, maybe 50, 60%, for some reason have had lots of experiences with loss, miscarriages. Mm-hmm. So acupuncture is shown to help reduce threatened miscarriages. So I think that's really huge. 1 in 4 pregnancies ends in loss, which is for a variety of reasons.
Not a whole lot, yeah.
Right, for a variety of reasons. So acupuncture helps with that. So I think that's really important.
So when would a woman start coming in? Like when she's trying to get pregnant, you'd have her start coming in? That would be the time.
Right. So for example, like I have a case back in the fall. She had had 4 miscarriages in the last year and a half. She'd had super hard.
Yeah.
Had a daughter, I believe she was about 4 years old, and just, lack of better words, wasn't able to keep the pregnancies and would lose them around week 6 to 10, which is, lots of developments going on at that time. So she started seeing me, and she was able to conceive within the 3rd month. And I believe she's about 6 months now.
Wow.
And she saw me throughout the first trimester, which is what I encourage them to do, is to come in within the first trimester once a week, just because with the health history that complicated, the last thing that I want to happen in my office is for a woman to have a loss, because she's worked so hard to get pregnant. Does that make sense?
Mm-hmm. Yeah.
And then I also, if they have a history of loss, then they have to take herbs. If they get pregnant with herbs, which naturally, then they have to take them during the first trimester to prevent loss.
Okay.
I'm pretty conservative with them, But usually patients are by the time they get pregnant, they're pretty much on board because they want to stay pregnant.
Yeah, yeah.
That history, does that make sense?
Yeah.
I also treat, about 85% of women during pregnancy will have nausea. So acupuncture can alleviate nausea. That's huge. It just happens to be that, they might be pregnant, right? So like I have lots of colleagues that right after school, they went and worked on cruise ships, and that's like 50% of what they would treat was nausea. So of course, acupuncture is really good for nausea during pregnancy. It's also really good for heartburn. Lots of women get heartburn, especially that last trimester. Constipation, acupuncture is really good for constipation, not, especially during the last trimester. Pelvic pain.
Okay.
I feel like I treat pelvic pain pretty well, and it can alleviate it at least usually about 50 to 70%.
So a 50 to 70% reduction in the pain, or 50 to 70% of people don't have it and don't have that pain anymore?
Oh, that's a good question. I can usually get most women to feeling 50% better.
Okay. Well, is there anything, so let's just run through again. We're looking at fertility, ease of labor and childbirth, also relief of just common pregnancy symptoms. If you have a baby in a breech position, does that cover what we talked about today? That's kind of a lot of stuff related to pregnancy that you could go see an acupuncturist about.
I guess anxiety, you could add anxiety.
Okay, yeah, sure.
Right.
That tends to fill up. Mm-hmm.
Lots of, women that have had loss before and they get really anxious because they're pregnant again. Yeah, you could add that to it.
Okay. Oh, and then also carrying women who have a history of miscarriage. Well, yeah, that's wonderful to know about. I definitely want to share this everywhere. Is there anything else you want to add? I think we've covered everything I wanted to talk about.
I think I'm good. I think that was a lot of information. If you ever want to talk about other women's health stuff, we could talk about specific things. But yeah, thank you for having me.
Okay, yeah. So everyone, Adrian Ortega, what is your address on Montana, Adrian? I'm sorry, I have a card.
Oh, it's okay. It's 2416 Montana.
Okay, so right there in central El Paso. I think I've got your information also on the event page, as well as on this YouTube page on my YouTube channel where the video will be living from now on. So if anybody wants to share it, and this is just great information to know, this is just another fabulous resource that we have for women here in El Paso. So I hope you guys will use it. You can see how wonderful and approachable and warm Adrian is. So anyway, thank you so much, Adrian.
Thank you, Rachel.
Okay, bye everybody.